Anything digital was a strict no-no to begin with. In fact, many companies used to come and I just used to shoo them away. I think it was COVID that changed us all. They wanted teleconsultation and they wanted a prescription when they were consulting. So to begin with, we were doing just WhatsApp chat. Then I realized this is not going to work and started experimenting around different tools. Eventually, zeroed in on Eka Care and started prescribing on Eka's pad, and so far so good. So after going digital, what happened was our so basically a website also got built up via Eka, online presence got built up, Google My Business got updated and got an appointment link via Eka Care. So what we started observing was that there was a cohort of patients who used to take online appointments. So the staff burden got reduced. Secondly, because now when the patient calls, the staff books an appointment, puts in the system. So now it is visible to me as well. I would not say it is going to drastically change anything, because in India, patients always want a human touch. So they come to the doctor to understand what is happening. They also need a kind of empathetic solution to their problems. They need that comforting voice that nothing will happen to them. So from that angle, I don't think AI is going to change a lot of things. But yes, AI has got a definitive role in easing out the life of a doctor. It's still early days, but we are quite hopeful that this AI thing will eventually evolve into some kind of a CDSS, the Clinical Decision Support System, which I think is still a bit far off, but doable. So yes, we have been spectacle for long, and we always try to ensure that data security and data privacy are taken care of by the software. Doctors are very intelligent people. It's only that they are not yet convinced, that's why they are not shifting. And I think that convincing is still something which everybody has to do. Good afternoon.
Thank you so much for giving us time out of your busy schedule. So, Doctor, can you tell us your journey of setting up practice and how did you start your clinic?
See, journey of setting up practice was a bit skewed to begin with, as after graduation doing my MD, I joined WHO and I was working in core public health to begin with, and then around 2017 I decided to take a plunge into the practice again, and I came back and in Noida I set up my clinic, and to begin it was a one room clinic, maybe hardly 100 square feet space, and started seeing patients as general physician. That's how I started my practice after a hiatus of somewhere around, I think, 7-8 years.
Doctor, at what point did you decide to make your practice digital and implement EMR for your practice?
See, to begin with, I was very skeptical about the digital and all this. Anything digital was a strict no-no to begin with. In fact, many companies used to come and I just used to shoo them away. That no, I don't want to go digital. I'm happy doctor, still writing on pen and paper, enjoying my good old days, medical college, scribbling on the pad, instructing the patients. And I think it was COVID that changed us all. During COVID, what happened was we were doing teleconsultations. It kind of bumped up. Everybody was confined to their homes. They wanted teleconsultation and they wanted a prescription when they were consulting. So to begin with, we were doing just WhatsApp chat, and eventually we were not getting paid. Then we started sending proper prescriptions written on our letterheads. It was a tedious task. So writing the prescription, then taking a picture and then sending across WhatsApp. Then I realized this is not going to work, and started experimenting around different tools. Eventually zeroed in on Eka Care and started prescribing on Eka's pad, and so far so good.
Doctor, what made you choose EKA over other EMR tools?
So I think it's pretty much straightforward. It's ease of use. The design element was quite simple. Navigation was simple. Things were straightforward. You logged in and there was a queue. You enter the patient details. The queue gets updated. You enter the patient details. You click on the patient name. You enter the visit part in the pad and you can start filling. And it follows the proper flow of our own medical training, like starting with history, examination, and you can upload reports, you can put in medications, prescribe lab test, whatever examination you are doing, those findings you can add, and you can call up for a follow-up visit, and eventually the longitudinal journey is there and it gets captured, and especially for non-communicable and chronic diseases, it is too much of importance that your longitudinal health journey gets captured, and especially when the patient comes again and again for the same illness, then it becomes vital to understand how the journey has been, what all changes you need to do, and obviously also to understand the nuance, how things were progressing and what point of time complications arose, what point of time different doctors have given their opinion. So all those things they get captured and it becomes easy to kind of manage the patient. In fact, very easy.
Doctor, from the patient's side, have you observed any satisfaction or anything from the patient's side that they share about you using an EMR tool for your practice?
So yes, there are many incidents actually. One of the patient was from IT sector and he said, I think it was around 2022 I guess. So he said, doctor, you are the first one I am seeing who is a detailed doctor, and you will not realize, but we are feeling really lucky to have you because your prescription gives us so much of detailing that there is no scope of error, and reaching out to you is so easy, and everything comes out in a proper format, and it really becomes easy to follow your advices. And he said that I have seen so many doctors, many senior doctors as well, but they don't follow any detailed tool and they don't use any detailed tool, and eventually we kind of lose a lot of time, energy and our mind space deciphering their handwriting. So that was a direct comment. Then a senior citizen came and he said, Dr. Saab, you write all the details so many times. I haven't told you, but I buy generic medicines, and because all detailing is there, I am able to purchase that very easily. So see, it's all about convenience at the end of the day. There is some flip side also. There are patients who continue taking the same medication for long because everything is detailed, so it is easy to take. They don't come back for follow-up visits as prescribed. But on the good side, there are also patients who say that because you follow a detailed prescription or a detailed tool, I get reminder for follow-up visits, and because of that only I am able to come up for follow-up. So it's a mixed bag, I would say, but still I think over a period of time I have realized that patients are quite satisfied with the quality of services that we provide, and on top of that a detailed prescription or a detailed service is a cherry on the cake.
So, doctor, when you must have decided to go digital, even your staff would have had to make some adjustments. Did you face any hurdles on your staff?
Yes, definitely. So it's not easy for staff to change tracks in between. They go habitual doing certain things, and so luckily for us, what happened is that we too also used to have a high churn rate to begin with, and staff used to come and go. So by the time we shifted to the detailed tool, there was again a new staff. So we had to spend some energy in training them, and obviously EKA also helped to begin with. So eventually they got trained, and now it's like nobody can work without EKA. So it's like that.
Did you get the kind of support that you were expecting from EKA's side?
Yes, obviously. So even the staff training was given. We were also trained to begin with, and now also whenever we need any kind of support, we get the requisite support. I don't find any hiccups. I cannot vouch for others, but for me it's okay. I'm quite satisfied.
Doctor, for your management related tasks and administrative processes, how has EMR helped you there in that?
A lot. So let me give you an example. So initially, staff used to get phone calls for appointments. So let's start from appointments. So the most basic thing or first step to reach out to doctor is to take his appointment. So after going detail, what happened was so basically a website also got built up via ECA, online presence got built up, Google My Business got updated and got an appointment link via ECA Care. So what we started observing was that there was a cohort of patients who used to take online appointments. So the staff burden got reduced. Secondly, because now when the patient calls, the staff books an appointment, puts in the system. So now it is visible to me as well. So when a patient is not coming or he's cancelling his appointment, we are able to we are able to at least catch hold. Okay, so somebody is cancelling the appointment. What is the reason? And sometimes we also instruct the staff to call them. That is one part. Secondly, because of the tool, the queue management has got sorted. So when the patient comes and he also kind of knows that what is his number, at what point of time he will be able to see the doctor. All those things got sorted out. And because to begin with it was manual, there used to be some hiccups, like patient used to come and they used to argue with the staff. So all those things have almost sorted out. Secondly, your billing. So everybody used to ask for bills. So initially we used to have printed bills. So all those printing tasks has just disappeared. We don't print any bill books now. Excuse me. Third is your you can say your records management. So a lot of patients, they used to bring paper records. So now what happens is that we request them to share the records beforehand. So what happens is that they share their record. If it's an online, like a PDF or a picture, they share it over to the staff over WhatsApp, or otherwise staff takes a pic of the hard copy and they upload into the system. And because system is also AI enabled, it is able to digitize records. So a lot of hassle is spared. Data entry has become easier.
Doctor, you mentioned AI, artificial intelligence. Can you tell, with regards to your practice and your specialty, like say for diabetology, how do you think artificial intelligence is going to change healthcare practice or medical care?
See, it is still early days. I would not say it is going to drastically change anything, because in India, patients always want a human touch. So they come to the doctor to understand what is happening. They also need a kind of empathetic solution to their problems. They need that comforting voice that nothing will happen to them. So from that angle, I don't think AI is going to change a lot of things. But yes, AI has got a definitive role in easing out the life of a doctor. Say, I will give you an example. So we struggle to find a nutritionist basically to provide diet the charts and all those things for or diet counseling for our patients. With the help of AI, we are able to provide contextual diet charts to our patients, depending on age, gender, even their kind of geographical kind of origins. Like a person from West Bengal has a different culinary habits as compared to somebody from South India, or again comparing to somebody from Western Gujarat or Rajasthan. So we are able to provide that. Second is, we are also able to kind of use the AI tools which are integrated into the PAT to kind of understand the nuances. Sometimes what happens is that a patient comes with a complicated history, and many times we are also kind of struggling to understand what are the probable reasons behind different issues that they are facing. So AI acts like an assistant and kind of helps us throw up certain possibilities, because it is already trained on medical literature. So it gives us some relevant kind of pointers, and we take a judgmental call if that is relevant or not. Third thing is your image analysis. So a lot of patients, they come for trivial dermatological problems. So many times we just take help of AI to understand what pointers they are throwing at us, and is it matching with their medical history or not. So we are utilizing AI to a certain extent. It's still early days, but we are quite hopeful that this AI thing will eventually evolve into some kind of a CDSS, the clinical decision support system, which I think is still a bit far off but doable.
Doctor, Doctor, with regards to engaging with your patient and giving your patient necessary patient education, do you feel EMR has helped you in patient engagement and patient education as such?
Yes, sir, to a certain extent, yes. So basically, we are able to, as I said, we are able to share diet charts, we are able to share other educational material through our EMR. It is also helping sort of maintaining compliance on the part of the patient. Also, there are certain tools through which we can send our messages. So that is also happening. So yes, to a certain extent, yes. Not very frequently, because again, doctors themselves don't want to engage too much with patients because it becomes burdensome. Unlike other businesses, customer engagement for us is a bit nuanced. It's not that straightforward that we will go on reaching out to our consumers. That doesn't happen that way. Doctors always try to be on the higher pedestal. So in a way, yes. Not very explicitly, but yes.
Doctor, do you use EMR for some research related interests of yours, analyzing patient data or other research related?
So yes, we have done a couple of real world evidence studies using our own EMR data, and I think if not for EMR, that would have not been possible, because you cannot manage records manually and then take out data and put it into a Excel sheet and then do the analysis. So that is not possible on a manual set of data. Through EMR, yes, definitely it has helped us, and we have done.
Doctor, in terms of data security and data privacy, how confident do you feel that using an EMR will also secure patient data?
See, I think that is a very big concern for every doctor, because our past experiences has been like people have come and they have pitched us some product, and then eventually they have diverted our patients to other doctors. So that has been quite rampant with at least those companies who have been on a lead generation model, where they provide appointments and on behalf of doctor to consumers on their platform. So yes, we have been spectacle for long, and we always try to ensure that data security and data privacy are taken care of by the software. So although I was a bit, you can say again, skeptical to begin with, but now I am pretty confident because of two reasons. One is over a longer period of time, say around 4 years, my patients have been loyal to me. So that has not been possible if EkaCare would have been doing something. So that is a very, very practical thing. Second, EkaCare is ABDM compliant. So ABDM, as per my understanding, any software which is ABDM compliant has to take care of data security and privacy, because that's what is mandated by Government of India. So because of these two reasons, I think I am quite confident that nothing bad is being done by Eka. So far, so good.
You've been using an EMR system for quite some time. So
Yes.
what do you think is going to be the future of these emerging technologies, and what would you like to see in the future being incorporated into your digital tool or your EMR system?
See, the future is very bright. The future is all tech and IoT and AI, no doubt about that. The thing is that, is it going to ease my life or is it going to burden my life? See, the problem is that health, unlike other industries, is a heavily regulated industry. So AI tools that need to come have to go through a certain process of validation. They have to be robust enough to kind of be able to support doctors in their day-to-day tasks. Currently, I still find the utility to be a bit limited to certain use cases. In the future, I think with the advent of connected care technologies going mainstream, and that data also available for analysis for the AI engine, you can say, we will be able to develop a more holistic understanding of the biology that is going behind a patient's illness. So currently we are still some time away from that, but I think that is the future, where when a patient comes, his wearable devices, our own stethoscopes, all those data gets triangulated along with the lab reports and help us generate a profile of a patient, and also leading us to a situation where we have some kind of a predictive analytics, so that eventually we will be able to actually practice precision medicine. So a lot of talk goes into precision medicine, but we are still not there because we have a shallow understanding of how different genes interact in different environmental conditions. So genotypic phenotypic combination that happens at an individual level, that is still not properly understood by the medical science fraternity as of now. But as and when the strength of your computational capabilities grows, and I would say the newer generations of AI tools come up, I think that's going to change.
Doctor, many of your peers are still not using an EMR system or are still considering to whether to shift to an EMR system. Do you have any experience to share or any advice that you would like to share with your colleagues or your peers regarding?
See, first you also need to understand that a doctor, when he's through his journey of his medical college, he's not exposed to any detailed tool. So when we are studying, when we are getting trained in hospitals, when we are getting trained during our postgraduate time, we are still using pen and paper. We are writing tons and tons of files, giving instructions, and not using any tool. So despite the newer generation who is passing out, they're all tech savvy. The Gen Z or the Gen, I don't know what new terms have come up, but they are all using all the latest gadgets, all the latest tech that is available off the shelf. It is being used. So one thing is that the newer, I would say, cohort of doctors who are passing out, they are definitely going to use some or the other EMR. The older cohorts who are, I think, near their retirement or who have spent whole life writing on pen and paper, I think it's futile to expect them to shift. And maybe even from that cohort, some people are very tech savvy, they would like to shift. And if kind of reasonably explained, they would try it out. But generally those doctors already have a heavy practice. And during heavy workload, using a detailed tool is somehow not manageable, because you need to invest at least a couple of months to understand how to work speedily on any system. Sorry. See, at the end of the day, it's a computer or a mobile based interface. And my speed of using that is also a function of my own ability to work on a computer or a mobile. So now that attitude or that capability has developed over a period of time. So doctors at the fag end of their career will find it obviously difficult to migrate to an EMR solution. Doctors who are in their mid career path, I think, are the right cohort to be approached and to be explained the benefits of EMR, because they doctors are very intelligent people. It's only that they are not yet convinced, that's why they are not shifting. And I think that convincing is still something which everybody has to do. And in our conferences, every time there is some or the other talk around EMR, but still people are a bit apprehensive. And one of the 2 or 3 major reasons which I think is around data privacy, security, challenges around robustness of the software, because doctors always fear that once electricity goes away or the software doesn't work, then how will they manage their practice in that case? So the robustness of the software system is very, very important. Okay, so I think, and all these things need confidence, and for confidence you need some players who are kind of who have spent decades in the industry. Problem is that there are companies who come, they launch their products and then they disappear. So there are a lot of fly by night operators, so a lot of doctors have already burned their fingers. So that's why there is a lack of you can say trust and confidence in the software industry as a whole, not only about companies but industry as a whole, that they are not good enough to provide them the requisite solution that they need.
Doctor, thank you so much for your insightful sharing and sharing your experience. Thank you so much.
Okay.